Good morning everyone. Our today's topic is Gunia worm eradication program. Till yesterday we have seen a National Filaria Control program, and in today's topic I would like to discuss you regarding this Gunia worm eradication program. So if you want to start this Gunia worm eradication program, first of all you should know what is this Gunia worm. So what is this Gunia worm? It is a parasite that is entering into the human body through contaminated drinking water, and it grows in the body for almost 1 year and emerges out as a burning blister in the skin. And the symptoms include here, what are the symptoms it is including? Symptoms include, it will just begin before the worm start to emerge from the blister. So victims will suffer with intense pain. It is often accompanied by bacterial infection and inability to walk. It is mainly affecting in the foot of the persons. It is mainly affecting in the foot of the persons. So can it be eradicated? Means yes. With no medical cure or vaccine, eradication will be achieved mainly through interrupting the life cycle of the parasite. How you can interrupt? Means through education. I will discuss you regarding the life cycle of this Gunia worm, so that you know how you can eradicate this without any kind of medical cure or any kind of vaccine. Community empowerment and low tech interventions like water filtration. So coming to this eradication of this disease, yeah, it was already eradicated from in India, but it is still present in some parts of the world. We will discuss this. So you can see it here. You can see the grey color countries. India, you see the grey color countries. These countries are having cases in 1986, and in 2005, these are the countries: South Africa, Ethiopia, and Chad and Mali. These are the countries which are having this Gunia worm even in 2015. Coming to the life cycle of this Gunia worm. So if you want to know the eradication, first you should know what is the life cycle of this Gunia worm, right? So I will say you regarding this life cycle. So if any person is consuming a infected water, if any person is consuming an infected water, what is this infected water? Means everybody know what is shrimp and crabs. So there are some tiny shrimps and crabs. Means when these are in their initial stage, this will be very tiny and you can't even see it in the water. So if any person is consuming those infected copod water which is having this larvae present in those tiny shrimp and crabs, it is directly entering into the intestinal system. See, entering into, how it is entering into the body? Through contaminated water it is entering into the body, and it is multiplying mainly in the intestines. Where it is multiplying? It is multiplying in the intestines. This Gunia worm, when it has entered into our body, it will be a microscopic structure. How it will be? It will be a microscopic structure. You can see it in the picture. This is the male one and this is the female one. Male one is very short in length, and female one, it can grow about 300 millimeters in length. Means it can grow about 3 feet long and 2 mm diameter in length. It is growing mainly in the time of growth at least for 1 year. So it will stay whenever the organism has entered into your body. Whenever it has started multiplying in your intestines, it will try to go and settle in the foot. Mainly it is going to trying and settle in the lower extremities. So what it will do? It will take nearly 1 year to get total length of this 3 feet. What is the time it is taking? It is taking nearly 1 year. So once it is taking 1 year, after a year after the infection, a full grown female worm that is up to 3 feet long, it will create a painful blister on the skin. What it is creating? It is creating, after 1 year it got infected, it is creating a painful blister in the skin. So once this painful blister is created, the people will tend to keep it in the water. Because of that painful blister, it will be in hot state. It will be causing some heat and pain. So in order to reduce that, people will go and they try to keep their feet in the water. So whenever these people are keeping it in the water, whenever the foot or the organism is exposed to the water, what it will do? It will release the larvae which is present in the female Gunia worm. This female Gunia worm is capable of carrying some millions of larvae. So whenever it is exposed to the water, whenever the blister is appearing, whenever the person is trying to wash his foot or keep his foot in the water for relieving of pain, then the Gunia worm will start to release the larvae. which is again going into the water and contaminating the water. Again, when when another person drinks this contaminated water, again the life cycle is started for this Gunia worm. So this is regarding this Gunia worm. Coming to the eradication of this Gunia worm. So how we can eradicate? So as I said, this Gunia worm is otherwise called as Dracunculus medinensis. It is otherwise called as Dracunculus medinensis, and this worm is mainly known as, this disease can be also called as Dracunculus medinensis or Gunia worm disease. Where it is affecting? This is mainly affecting the largest, this worm is the largest of the tissue parasite affecting the humans, and it carries about 3 million embryos, and when it is exposed to the water, these embryos are getting released into the water again. Coming to this Gunia worm eradication program, it was launched in India in the year 1998, mainly with the technical assistance from the WHO. Who gave the technical assistance? WHO gave the technical assistance, and it was launched in India in the year 1984. Coming to the strategies of this Gunia worm eradication program, and efficient information at all levels. They want to provide efficient information at all the levels, and close collaboration with WHO and UNICEF. The country has reported 0 cases since 1996. With the help of this close collaboration, with the help of this WHO and the UNICEF, the country has reported 0 number of cases since August 1996. And in February 2000, International Commission for Certification of Dracunculus Eradication recommended that India be certified free from this Dracunculus transmission. Close collaboration from WHO and UNICEF, the country India, it has reported 0 cases since August 1996, and in February 2000, the International Commission, which is responsible for this Dracunculus eradication, recommended that India is free from this Dracunculus transmission. In which year? In February 2000. So the Gunia worm eradication program, it was started in the year 1983 to 1984, mainly in 7 endemic states. These states are Tamil Nadu, Gujarat. These states are Tamil Nadu, Gujarat, Maharashtra, Andhra Pradesh, Kerala, Madhya Pradesh, and Rajasthan. So these were the states which were affected by this Gunia worm in India. At the time, about 40,000 cases of Gunia worm disease were reported. And coming to the eradication strategies, what are the eradication strategies here? Provision of safe drinking water. So as we have seen it in the life cycle of Gunia worm, so through where it is affecting means it is mainly affecting through the contaminated water. So if you are able to educate the people who are affected with this Gunia worm to not to go and pollute those river waters, then you can definitely control the transmission of this disease Gunia worm and control of cyclones population. Into the health education of the public, active surveillance and case detection. What they have to do? They have to go for active surveillance, and they have to detect the case as early as possible and treat those cases which had been detected. And WHO declared India as a Gunia worm free country in February 2000 and advised the government to maintain the surveillance of Gunia worm disease till its global eradication. Even though this disease is not existing in India, it is still present in the other parts of the country. In sometimes through any means, there is a chance for reappearance of this disease in our country also. So in order to prevent those reappearance, what the WHO has recommended, it has recommended an active surveillance for cases detection, so that the diseases can be prevented as early as possible when it got identified. So this is regarding Gunia worm eradication program. Thank you for listening. If you have any queries, you can contact me through my email and through my WhatsApp. Thank you so much.